I'm Kosali Simon. I'm a health economist, and I teach and do research in the O'Neill School of Public and Environmental Affairs. So economics combines these fundamental principles of theory that understand how people might react to a change in incentives, and combines that with bringing in large-scale data to test out theories. So we want to know if we could get all of the hospital data, all of the pharmaceutical data in the US, what is it we would expect from a good policy, and can we see that actually happening with changes that have been made? When the Affordable Care Act passed, it provided me an opportunity to take what I have been studying in the context of state insurance reform and apply it to federal change. So one of the first things I studied was the first provision of the Affordable Care Act that people mostly will remember, which is the young adult mandate. This was a law that allowed children until the age of 26 to remain on employer-provided health insurance of their parents, and it was a bipartisan, really popular aspect of the Affordable Care Act. What my colleagues and I did when we knew this feature was in the Affordable Care Act was think ahead of time about what data and what methods would help us answer this key question of, was it successful? So we were able to take government-provided data sets and very quickly turn it into answers that showed the number of Americans that were insured was more than people had ever imagined. It was close to 2 million. This led to a publication in a widely read economics journal and coverage in major news outlets such as the New York Times. My two research areas right now are healthcare reform and the opioid crisis. In the area of healthcare reform, which has been a struggle for this nation for decades, the big question that remains is both a political one and an economic one. How are we going to figure out how to cover more people's healthcare at a low price as possible? And what are the ways we're going to get political will to try things out? Within the broad topic of the opioid crisis, which has been identified as one of the grand challenges of the university, the big question that comes next is how we get people into treatment and how we avoid public health issues like this in the future. The opioid crisis is really scary for everybody because of the fast pace of change. On the one hand, we seem to know what policies can reduce the prescribing of opioids, but what do we do about the illicit market? Ultimately, where policy needs to be focusing is strengthening behavioral health. Not only would that help us in overcoming this current crisis, but it will also make us able to deal with whatever public health crisis comes next around the corner. One of the reasons it's really hard to predict where we're headed with healthcare reform in the US is that it's not only the evidence on what works that seems to carry the day. There's a heavy dose of politics involved, and it's hard to predict what policymakers are thinking that their constituents will want them to do.